Nursing has always embraced a holistic approach to patient care, which includes the spiritual dimension. In this lecture, I will review the role of the LPN in providing spiritual care to the client and family as a member of the healthcare team. I will also discuss members of the healthcare team who can help provide spiritual care and key nursing interventions to meet the spiritual needs of clients. Religion in the U.S. is very diverse. There are over 200 distinct church traditions, but most of the U.S. is Protestant and Christian. There is also diversity amongst the same religion, so it is important to avoid false assumptions and stereotypes. There are also agnostics and atheists. Agnostics hold the belief that the existence of God can neither be proved or disproved. Atheists do not believe that the supernatural exists, so they do not believe in God. Spirituality is an essential part of a human being. It is the essence of a person and includes the beliefs and values that give people strength and hope. Spirituality gives meaning to life. Religion is a spiritual experience that contains specific beliefs and values. It makes rules and captures experiences in a system. Spirituality is the way individuals seek and express meaning and purpose, and the way they experience their connectedness. Spirituality allows our humanity to touch that of another by providing presence, deep listening, empathy, and compassion. It plays a fundamental role in helping people cope with severe illness and end-of-life decisions. Can you have spirituality without religion? Yes. Religion may be a spiritual experience that includes spirituality, but spirituality for one's life force does not necessarily include religion. Both spirituality and religion provide a set of beliefs that brings comfort and an ethical compass. The spiritual dimension of a person gives insight to the meaning of life and to suffering and death. It is the relationship to a higher power. Emotional needs include how people respond and deal with their feelings about life, death, joy, anger, sorrow, or guilt. When spiritual and emotional needs of clients exist and are met, LPNs can say they have directed care to the total person. Spiritual care involves helping clients to develop an awareness of and maintain their spiritual needs. Florence Nightingale encouraged nurses to be instruments of spiritual caring in all situations. Today, many accrediting bodies require healthcare facilities to assess spirituality in patients. Patients who are hospitalized, in pain, have chronic or incurable illnesses, are dying, or are facing an undesirable outcome all need spiritual care. Patients' beliefs and values can profoundly affect their response to these crises, and situations like this may intensify the need for spiritual care. Healthcare workers are not good at discussing spirituality with patients. They are hesitant and afraid of offending. Many facilities have chaplain services, but spiritual assistance is usually requested later rather than sooner. The pastoral care team includes ministers, priests, rabbis, consecrated religious women, representatives of other religious organizations, and lay persons. They are all educated to meet the spiritual and religious needs of those in a healthcare setting, including the staff. Florence Nightingale is considered the mother of modern nursing. We've discussed her history of providing care to the wounded during the Crimean War and helping to dramatically reduce infection rates by introducing basic hygiene in the wards near the front lines. She ultimately became an advocate for compassionate care for the suffering throughout Europe. Then in 1967, Cicely Sanders opened the first hospice center over the objections of many within the medical community. This act helped to bridge teaching, clinical research, pain and symptom control, and compassionate care. Her creed of living while dying allowed for families to spend time with the dying, for pain to be controlled by medicines, and for the discontinuation of painful treatments intended merely to prolong life. Hospice care prioritized the meaning of life, putting spiritual and religious care at the forefront. Nursing is a holistic profession. Nurses are taught to treat the whole patient, not just the physical illness. However, despite understanding the importance and being well trained, many nurses feel ill-equipped to deliver appropriate care, especially at end of life. Nurses feel uncomfortable discussing personal beliefs and also feel like they don't have the time to offer spiritual care. But as we are learning, nurses do play an important role in the spiritual care of our patients. The first step in providing spiritual care for nurses is to be aware of your own spirituality and know yourself. Once you know yourself, you can better help others. Acknowledge that your beliefs may work for you, but not others. Spiritual care can be as simple as listening and spending time with our patients. Assist with religious rituals and act as a liaison between families and the medical staff. Assist with end-of-life discussions and provide emotional support. How do nurses address the spiritual needs of their patients? We use the nursing process. Nurses assess the spiritual needs of the patient and listen for spiritual distress or concern. The RN will formulate the nursing diagnosis, spiritual distress related to, with the assistance and input from the LPN. Nurses plan with the patient how their spiritual needs can be addressed, what resources can be provided, and make necessary changes to care plans. Nursing interventions affirm and respect each patient's spirituality, organize and facilitate spiritual resources, and refer to a chaplain as needed. Lastly, nurses evaluate patient outcomes to determine to what extent spiritual care has been of benefit, review outstanding spiritual care needs, and consider what changes may be needed to a plan of care. All people have a spiritual self. Listed on this slide are questions you can ask to assess a person's spiritual self. How comfortable are you asking these questions? Listed on this slide are NANDA-approved diagnoses related to spiritual care. Listed here are nursing interventions you can use to meet the spiritual care of patients. This is also referenced in box 11.1 in your textbook. When implementing interventions for spiritual care, it is important to avoid stereotyping and don't consider all clients the same. Spiritual distress can be observed in clients who are unable to practice their religious rituals. Therefore, it is important to respect and allow patients' spiritual practices, rituals, and prayer. As a nurse, how do you know your interventions were effective? You determine if the outcome was achieved. This should be specific to each individual and outcome. For example, did the patient interact with a spiritual leader as requested, or did the patient use a spiritual experience that provided comfort? When spiritual needs are met, patients have improved coping and increased quality of life. They have increased satisfaction and tend to use less aggressive care and are more open to hospice care when appropriate. If spiritual needs are not met, patients rate care as poor, there is increased caregiver burnout, and anger directed to healthcare providers. To summarize, addressing spiritual needs in our patients is important. Understand your own beliefs first and be comfortable knowing that what works for you won't work for everyone else. Relying on other members of the healthcare team, especially facility chaplains, is an essential part to ensure positive patient outcomes. Thank you.